Unveiling the transformative power of psychedelic therapy, healing trauma, addiction, and beyond. Psychedelic therapy, a revolutionary approach to mental health treatment, has garnered significant attention in recent years. Harnessing the therapeutic potential of substances like psilocybin, MDMA, and ketamine, this post explores the profound impact of psychedelic therapy on healing trauma, PTSD, CPTSD, addiction, depression, anxiety, and supporting terminally ill individuals in coping with stress and anxiety related to their illness. While discussing ongoing trials in London and the potential legalization of psychedelics in the UK, it is important to note that this post is for educational purposes only. Psychedelic therapy for trauma, PTSD, and CPTSD. Numerous studies have shown the success of psychedelic therapy in treating trauma-related disorders. Research on MDMA-assisted therapy for PTSD has demonstrated an impressive success rate of 60–70%, with long-lasting improvements in symptom severity and quality of life. Psychedelic therapy, including the use of psilocybin, has also shown promise in addressing complex trauma, CPTSD, by facilitating emotional breakthroughs, promoting inner healing, and reducing symptoms. Addiction and psychedelic therapy. Psychedelics, such as iboga, ayahuasca, and psilocybin, have shown potential in treating addiction. Iboga, derived from the tabernanthe iboga plant, has been used traditionally to treat opiate addiction. Studies have reported success rates of 50–80% in reducing cravings and withdrawal symptoms. Similarly, ayahuasca, a plant-based psychedelic brew, has demonstrated promising results in treating substance use disorders, particularly in the context of addiction to substances like alcohol and cocaine. Depression, anxiety, and terminal illness. Psychedelic therapy has exhibited significant efficacy in treating depression and anxiety. Psilocybin-assisted therapy has shown remarkable success in reducing depressive symptoms, fostering emotional breakthroughs, and enhancing overall well-being. Additionally, psychedelic therapy has been employed to support individuals facing terminal illnesses, helping them confront existential distress, reduce anxiety, and find meaning in their experiences. Countries legalizing psychedelic therapy. Several countries have taken progressive steps in legalizing psychedelic therapy for mental health professionals. These countries include the Netherlands, Canada, Australia, Brazil, and Switzerland. These advancements have allowed for the expansion of research and the integration of psychedelic therapy into clinical practice. Psychedelic therapy in the UK. Exciting developments are underway in the UK, particularly in London, where clinical trials exploring the therapeutic potential of psychedelic therapy are taking place. You can watch these trials in a fascinating documentaries, Magic Medicine and How to Change Your Mind. These trials aim to evaluate the safety and efficacy of psychedelic substances in treating a range of mental health conditions. With growing evidence and public support, there is hope that psychedelic therapy may soon be legalized for therapeutic use in the UK. The neuroscience behind psychedelic therapy. The precise mechanisms underlying the effectiveness of psychedelic therapy are still being explored. However, research suggests that psychedelics interact with serotonin receptors in the brain, leading to increased neuroplasticity and the formation of new connections. This neuroplasticity, combined with the therapeutic setting and guidance of trained therapists, allows individuals to gain new perspectives, challenge limiting beliefs, and break free from destructive patterns. Important considerations. Psychedelic therapy should always be administered under the guidance of trained professionals in a controlled and therapeutic setting. It is essential to prioritize safety, as psychedelics can have potentially adverse effects on individuals with heart disease, those taking specific medications, epilepsy, or a history of schizophrenia. The presence of a therapist ensures a supportive environment and facilitates integration of the experiences during and after the psychedelic session. Psychedelic therapy is an emerging and promising approach to mental health treatment, offering transformative potential for individuals struggling with trauma, addiction, depression, anxiety, and terminal illness. Ongoing trials in London, coupled with increasing global recognition, highlight the potential for psychedelic therapy to become a legal and regulated treatment option in the UK. While further research is needed, the profound impact of psychedelics on perception, beliefs, and habit change underscores their potential as catalysts for healing and personal growth when utilized responsibly and within the context of therapy. By Lena Kravitz, Knowledge is Power. If you're interested in learning more about this topic, you can watch those documentaries. Magic Medicine, How to Change Your Mind, Dosed from 2019, Dosed, The Trip of a Lifetime from 2022, Unwell Series, Episode 4, History 101, Season 2, Episode 4. Here are some books on the topic. Psychedelics and Psychotherapy, The Healing Potential of Expanded States, by Tim Reed, Maria Papaspyrou, and 𝗣𝗍𝗆. The Psychedelic Explorer's Guide, Safe, Therapeutic, and Sacred Journeys by James Fadiman. How to Change Your Mind. What the New Science of Psychedelics Teaches Us About Consciousness, Dying, Addiction, Depression, and Transcendence by Michael Pollan. By Lena Kravitz, Knowledge is Power.